Good afternoon, everybody, and thank you for attending this press event we have today. The nature of this press conference is just to discuss the cold weather. We are Western New Yorkers. This is something that we inherently deal with, but we've had some mild winters over the past couple of years, so we just want to remind everybody with the significant wind chill factors, the snow event that'll be coming more tomorrow. We just wanted to give everybody a little heads up because things are changing. If you look outside right now here in Mayville or much of the southern part of Chautauqua County, it's sun's out and it's blue skies. But they are still in single-digit temperatures. In some places, it is below zero. And with any sort of wind, that drops our wind chill considerably and puts people at risk. Again, I have with me today Carmela Hernandez, the Director of Mental Hygiene and Social Services here in Chautauqua County. Next to him, I have Dana Corwin, the Director of Office for Aging Services. Next to her, Lacey Wilson, our Public Health Director. And to my left, Noel Gutman, Emergency Services Director. Again, what we're talking about is the extreme cold and wind chills that will be dropping to as low as minus 20 degrees below zero, and the risks that are affiliated with that. Minimal exposure to bare skin will present risks, so we'll leave that to our professionals. Lacey will address that in a little bit. At this time, we're asking our residents to stay indoors, limit your outdoor exposure, and on the other hand, also please check on your loved ones and relatives. We do have Dana here with Office of Aging Services. She'll touch on our vulnerable populations. As well as a 36-year member of the volunteer fire organizations, we do ask everybody to please be vigilant. This time of year, you like to put space heaters and warming blankets and other means to warm your house. Out areas, out barns, we try to use other means to keep things warm. Make sure that if you're using any sort of home devices, homemade remedies to conquer the cold, make sure that you're very careful because yesterday we did have a house fire in the town of Gary, and fires at this time of year are very common due to overuse of electrical outlets, heating elements, different type of heating devices, but it also puts undue stress on our volunteers as things freeze rather rapidly. So without further ado, we're going to turn it over to our Public Health Director, Lacey Wilson, to discuss frostbite and hypothermia.
Thank you, County Executive. I am always privileged to be here on behalf of the Public Health Department here in Chautauqua County. It is our main focus and mission to prevent disease and disaster when we can, promote our health and wellness, and to protect our community. So we always are appreciative of these opportunities to be in front of the public and in front of the media to promote those messages in some very thoughtful ways that we can take care of ourselves and each other during these potential hazardous events. So as the county executive alluded to, there are others, our partner agencies and friends, who will certainly talk about some specific ways that we can protect ourselves and each other. But just to note a few high-level ideas and things that we can do to safeguard ourselves, specifically in regards to frostbite and hypothermia, to ensure that if you do need to go outside and there is necessary travel or work that you're doing outside, to wear light layers, to stay hydrated, because of course as you pack on those layers, you perspire more, and so you also don't want to suffer dehydration because of that heavy work and heavy lifting you may be doing outside. Make sure that you are covering any exposed skin, especially for our children and our older adults. And when you can, as we said, limit that time outdoors and any unnecessary work that you need to do outside. The other thing, important to highlight is one of the many wonderful assets that we have here in Chautauqua County is our community and our very neighbor-focused, kind of mindset here. So this is a wonderful opportunity, if you don't know some of your neighbors, to get to know them, check on them, and I'm sure Dana will touch on this specifically, again, our older adults. And anybody that you may know that is experiencing housing issues, Carmelo and his staff will be able to direct you to some more information in regards to, things that you can do in that regard to help direct people to the right information. And then the other thing to highlight is specifically, again, the mindfulness about where you need to go and what you need to do and limiting that as much as possible. Our EMS professionals, our emergency professionals, our emergency rooms can very easily become overrun during times of year and seasons like this. So in order to help our friends in those professions, if we can ensure that we're really, again, limiting, those risky decisions, that we might make in snow sports and things like that this time of year is helpful in ensuring that those systems do not become overrun or overburdened. The other thing to highlight, of course, if you are experiencing any issues, skin-related, redness, irritation, that you would call your health professional. Each individual, of course, has specific needs. And so really it is your health professional, your primary care physician that you'd want to contact, and they can lead you for the best next steps. Thank you so much. And at this time, I think Carmelo will be joining us.
Thank you guys, and most definitely stay warm out there with the frigid temperatures that we have. The resources that I'm about to share, you can find them at chqgov.com/cold blue. And cold blue is when temperatures drop 32 and below, we can provide housing or emergency shelter, also with warming centers as well during the day, in the sense of the fact that you don't have to go through the original intake process when it comes to the emergency housing. So for our cold blue is ran by Recovery Options Made Easy. It's the overnight 917 Washington Street in Jamestown. In terms of our warming centers, you could come to either 15 West Lucas Avenue at Dunkirk or at 110 East 4th Street in Jamestown from 8:30 to 4:30, and where arrangements can be made for emergency housing or if you need cold blue. This is important to note that cold blue is for individuals without minor children. So that's important. If you have minor children, we could assist you if you come to one of our locations in providing you a separate type of housing. With that being said, after hours, weekends, and holidays, the overnight cold blue shelter is available. No referral is necessary. Families seeking emergency shelter non-hours are encouraged to contact the Chautauqua County Sheriff's Office at 716-483-7536 or reach out to the nearest law enforcement agency. We encourage anyone to reach out and take advantage of this vital service. Some of our partners are Orion Hall Memorial Library in Brockton. These are for the warming centers during the day. Alexander Free Library in Sherman, Asheville Free Library, Asheville, New York, Chautauqua Opportunities in both Dunkirk and in Jamestown. And we also have, of course, our Department of Mental Hygiene and Social Services during the day in both Dunkirk and Jamestown. Ellington Farman Free Library, Ellington Hazeltine Public Library in Jamestown, New York, James Prendergast Library, Lakewood Memorial Library, MHA Mental Health Association, Myers Memorial Library, Sinclairville Free Library, and UCAN City Mission. The addresses and the times that they're available during the day to be a warming center, even if the temperatures is not cold blue. It'll be on the website, as I mentioned earlier, at chqgov.com/cold blue. Thank you guys very much. Stay safe out there. Take care of one another, and I'll pass it over to our Emergency Services Director, Noel Gutman.
Good afternoon. Just want to touch on a few fire safety and overall safety issues that we can do to make ourselves safe, our family, and our friends. County Executive Wendel brought up, this time of year, a lot of people are using fireplaces and fuel that way. If you're using your fireplace, make sure it's properly vented. It's been cleaned before now, hopefully, and that we're burning the proper materials in those. This time of year also brings an increased use of space heaters. Ideally, your space heater should be a UL-listed device to make them safe, and I believe I've never seen a space heater that says it's safe to use with an extension cord. So make sure they're being plugged into the main wired-in wall outlets. That is don't put them in a daisy chain. Don't put them into an outlet strip. Those have been oftentimes the cause of many fires around the county and the state and nationally. This time of year, it's also good time of year, new year, to check the batteries in your smoke and carbon monoxide detectors, especially if you're using any type of, mentioned fuel or heating products in your house. And of course, we want to always mention the road safety, traveling to and from anywhere you're going. Traveling this time of year in Western New York, a good motorist has a plan, has some extra warm clothing, and potentially some emergency supplies in your vehicle in case we get stuck, as we've seen happen in the last winter storms around here. Those supplies could be some type of some food, some extra blankets. Make sure your gas is at the proper levels before you go, and most importantly, make sure it's safe to drive. And we like to pride ourselves in Western New York, saying that it's Western New York. We're used to it, but make sure that the traveling is really worth the effort, and heed the warnings for travel advisories and travel warnings. A good method for that is obviously our county website, but also so anyone can sign up free for the New York Alert. That's a great service that New York provides to give alerting messages to the public and anyone that signs up for that. At this time, I'll hand it over to Dana from Office of Aging.
Good afternoon, and thank you all for being here. Couple points when we're talking about dealing with our older population and supporting them in this weather emergency. We would like to ask everyone in the community to check in on your elderly relatives and your neighbors. The elderly may be less likely to sense and respond to these low temperatures that we're experiencing. Problems like diabetes or thyroid problems, arthritis, Parkinson's, many of those diagnoses that we have as we age kind of tend to limit our abilities to deal with these cold temperatures and snows, and definitely contribute to falls, which happen in the home quite frequently. Those living alone can also be isolated and possibly not equipped to deal with the dangers posed by winter weather. So there are some things that you can do in your areas, in your communities, that we would like you to do. We'd love to have you phone your neighbors or stop in, as Lacey said, and check on your neighbors. This is important. You want to make sure that they have food and that they have water and that they have medications on hand. You can also do simple things like clear their steps, salt a walkway, clear a walkway, and see if they need any help keeping vents and pipes cleared. It's great to confirm the heat source, as Noel had suggested, and check those smoke alarms and carbon monoxide detectors. And when checking on your neighbors, look for signs of age-related cold illness like hypothermia. It can really set in rather rapidly. And signs and symptoms to look for include cold hands and feet, pale skin, shivering, exhaustion, some cognitive changes like anger where there's usually none, confusion where there's normally none, and memory loss, sleepiness. All of these things can contribute from being too cold quite rapidly. Cold can affect all of our vital organs and make all of them work harder. So it's important to check on our older adults, and it's important to take care of each other. If you're working in the community outside, make sure you're covered, as Lacey had indicated, but also be sure to call for emergency help if there's any stress to the system and you're experiencing physical stressors like chest pain or shortness of breath or signs of hypothermia, and definitely call 911 for assistance for that. New York Connects is available to anybody in the community to call for information on heating assistance programs, home-delivered meal programs, and warming centers in the county. And the county website is also a good resource. New York Connects has operators and will return your phone calls if we get a lot at one time. We can assist with information and assistance for programs and services. We want you to know that the Office for Aging Services now has an automated service, a messaging service that can go out to older adults and their caregivers, either by email, text, or voicemail. And this can help inform our older adult population and their caregivers and providers of different things going on in the community. So if you're not signed up for that, give us a call at New York Connects, 716-753-4582. We do need you to help check in on your neighbors and help us work through this weather situation. Thank you. Back to PJ.
All right, thank you, everybody, for being here. Again, we're just exercising an abundance of caution right now. We don't see in this immediate area, the southern part of the county, if you will, any heavy snowfall. That has been isolated to the northern part of Chautauqua County at the present time. But as this evolves tomorrow, there'll be some more lake effect snow bands, and that snow event should be more widespread throughout the county, but these temperatures are very critical. Again, if you're outside trying to shovel, it can hamper your shoveling, the snow clearing events, so we ask everybody to please use an abundance of caution. Having said that, we'll entertain time now for any questions. Greg.
Carmelo or PJ, how's the attendance been at the Cold Blue Shelter in Jamestown? How has the attendance been at the Cold Blue Shelter in Jamestown?
Attendance has been consistent. Attendance has been consistent, anywhere between 30 to 35 participants a night during Cold Blue.
All right, and then how many could that shelter hold?
So the good news is they could hold anywhere between maximum 40. However, our due diligence that we did, myself, John Anderson, deputy, and also Diane Anderson, was we actually rented rooms within the county that we have available for Cold Blue, specifically in case of emergencies like this. Just in case the Cold Blue reaches capacity, we still have areas where we can send them throughout the county.
Okay, and then people who are in the North County that are homeless, where are they being directed?
So typically what we do with them, if they can't make it down to the Cold Blue, we have hotels in North County that we utilize rooms, specifically for Cold Blue.
Okay, any idea how many people you've had to house in the north end of the county?
North End has been low. North End has been no more than, I believe, 6, the last number that I received from the team.
Okay, all right.
Anyone else? Anybody online, Justin, with any questions?
Looks like Channel 4 is on here. Maybe you can just say, they can unmute their mic.
Yep. If anybody has any questions online, you want to unmute your mic, you can ask. Okay, well, seeing none, we appreciate everybody's time, again, reaching out to the residents and those that are going to be viewing this. Right now, we do not have any travel bans here in Chautauqua County. This press conference and this was basically just to make everybody aware. We do have some very frigid temperatures coming overnight, and we just ask everybody to use an abundance of caution. We want everybody to stay safe. Thanks for attending, and have a great day.